My name is Leonard Hinton. I'm the co-founder and CEO of Crediyo. At Crediyo, we help patients pay out-of-pocket medical expenses while also helping healthcare organizations collect more money faster. We founded Crediyo to help people like Patricia that have insurance but are skipping required healthcare procedures because they cannot afford the cost. Patricia is like many Americans that don't have adequate savings. Health insurance deductibles are as high as $12,000 in some states. Out-of-pocket medical expenses will grow to $180 billion a year. More than half of this goes to collections. This is going to impact 60 million Americans, and one of the biggest problems is patients don't understand their insurance. Our solution makes it easy for healthcare providers to offer financial options at the point of care. Much like retail providers offer in-store financing options, we are transforming a confusing patient billing experience and creating a retail-like checkout experience that also helps providers increase collections by 20% that go straight to the bottom line. Our analytics can predict whether someone qualifies for a loan before they even walk into the practice. What's most important is we score every patient. Our software basically creates two product options for consumers. So if you have reasonable credit, you can get a loan at the point of care, and we pay the practice within 5 business days. For consumers that have challenged credit, we can still help you get access to healthcare by providing incentive-based payment plans where you earn a discount for positive repayment behavior. We have a 3-part revenue model, and our team has experience in consumer lending, issuing more than $1 billion of consumer transactions, and we also have more than 25 years of collective healthcare experience. We've also assembled a great team of advisors and partners to help us scale this opportunity. We're growing from our 6 current customers and are working with distribution partners like Athena Health, and we've also developed our own proprietary model. Our vision is to make payment for medical procedures transparent, personalized, and simple. Thank you.
Judges?
So this sounds, it's sort of, I'm super familiar with, as you are most likely, Credit Karma, and you think of basically what's happening in traditional financial services. You're basically a Credit Karma for healthcare.
Yeah, so we're combining point-of-service software and bundling a marketplace lending concept.
Right. Okay.
Leonard, will you help me understand what happens for that patient who has the poor FICO score and medical debt? What happens to them at the point of care?
Sure.
When their score shows up like that and suddenly they're not a great loan for you?
Yeah, so what's unique about our solution is it's 2 parts, right? We're not tied to just loan products. We can actually use the same score to recommend options for the practice to collect with that patient. So instead of having the administrator negotiate a down payment, our software knows that person's ability to pay, and we can recommend minimum down payment, maximum terms, and optimize collections through using technology. So we sign people up for automatic payments, whether it's ACH, credit card. And so the idea is that we reduce the friction in the process and increase collections for both of our products.
So which segment have you started at in terms of physicians' offices? Are there a GP? Are you going to OBGYN? Just out of curiosity, who's been the most receptive?
Sure. So we've done a lot of top-down analysis of different outpatient facilities. So we've tested a few areas that we like. Imaging is one channel that we're excited about. We are testing stuff in OB, and we have an Athena Health client that has 16 doctors, and there are multiple specialties in that practice. So the idea is to try to figure out what are the biggest pain points, especially as deductibles continue to rise.
So it seems like key to this is having the patient know exactly what they owe when they're leaving so that you can intervene, which is not the easiest thing in the world to have happen, having spent many years at Athena. and that's the best case scenario. So has that been an obstacle for you?
Yeah, no. So I mean, this is exercise in storytelling, so I'm making it very simple. But across the board, price is one of the biggest components that we need to get. So we can take your credit score and a number of alternative data to score like your credit worthiness, but we need to understand the price. And so we're working with a few options. One is we use estimators and we use the existing workflow of the practice where they're already identifying out-of-pocket expenses before that appointment is scheduled. And so we just digitize that process. And the other option is we won't know price for larger complex procedures, but we sign up the user earlier. And so part of our hypothesis is that through early engagement, you change the performance of what billing looks like in the US, which is pretty terrible.
And how resistant are the staff to introducing this new process?
Another good question. So it varies. So we have a couple of approaches. One is technology-driven, where the administrator is not heavily involved. And the other is if you have a really good hands-on administrator, you empower her, right? And so we're testing a combination of both. We're trying to figure out a few things that will scale. Over time, we think product makes a difference. And so that's why we want to get integrated with EHRs, because we can make a better user experience both for the practice as well as the patient.
Do you have 2 or 3 use cases where you've really changed a patient's life?
I would like to think so. So to be fair, we're starting with routine health procedures. So we're not in larger, complex inpatient procedures, which does have a different drastic health outcome. But the idea is over time to go into more inpatient workflows. But right now we're in the outpatient facility and working with a few independently run practices, and we're also talking to larger providers as well.
Leonard, my understanding is there's a fair amount of competition in this space, and I would love to be able to walk away today with here's how Crediyo is differentiated.
Sure.
Can you make that really crisp for me?
Sure. So healthcare lending is nothing new. And so the 2 filters that I typically use is whether a procedure is elective, right? And so that's dental, plastic surgery. The other filter is whether or not they're in a larger hospital, right? And so we think there's an opportunity for Crediyo in non-elective healthcare procedures in the outpatient facility, and also the combination of the loan product and the payment plan, right? So we can, in theory, provide a solution to 100% of the patients that have out-of-pocket expenses, where a competitor like Care Credit only does elective, and if their footprint is basically tied to the demographics of that clinic. So if you're in Palo Alto, like, probably have no problems. If you go to other areas, like the Bronx, it's a little bit different. So we think our solution plays well into both areas. So we can go in good demographic areas as well as providing access in lower income areas as well.
And are people beginning to think about tying this into the patient portal to pay for your balance sort of after the visit? So when you suddenly get notified that you owe someone $400, $500 because it finally gets settled,
right,
that they can connect right to Crediyo?
Yeah, so we do think that's an opportunity for us. We've tested kind of a direct-to-consumer play where consumers can go on our website, submit a bill, and then we partner with advocates that negotiate on their behalf, and we bundle a lending product there. And so we're testing it to learn. We think there are some adjacencies that we can go into over time that make sense to try it. But right now, our core business is through the providers.
Great.
One more question.
All right, one question. Do you know if these people have HSAs?
It's a good question. So we can process HSAs with a credit card. So we can work around an HSA. We can also address underfunded HSAs, right?
Because that's a big issue for them. The self-insured employers take money out on a monthly basis, and if you're on a high deductible plan, if you have an event at the beginning of the year, you end up paying out of pocket.
From experience.
Yes, from experience. Yes, I had ACL replacement surgery, so you end up paying out of pocket until you can catch up, and that was interesting because if you work with the employer, then you would know for sure the money is there, right?
Sure.
And you could get it. and it might be an interesting service for a big employer.
We can talk to GE anytime.
Leonard, thank you very much.